Midwives for Moms. So this has been a core initiative for the college for the past 3 Congresses. So we are in our 3rd Congress trying to get this legislation moved through. And essentially what it does is it creates a permanent federal funding stream for midwifery education programs. In the advanced practice provider space, there are lots of opportunities for other types of providers. Midwives want to have a similar funding stream that they can tap into and access that is only for them. Right now we have the ability to do so, but we are going up against other professionals and other provider types. So Midwives for Moms is great legislation that would do a number of things. It would create a permanent federal funding stream through the appropriations process. So that's the federal budget. We have been able to get funding authorized or funding appropriated. What we're doing now with Midwives for Moms is to get a permanent program authorized, one that does not go away, one that is always funded because it becomes part of federal law to do so. And it will allow us to provide scholarships for students. It will allow programs to pay for preceptors to help educate and train our students in clinical sites. It prioritizes funding for programs who use it to diversify their student body and their faculty. And also it will prioritize funding the programs whose students make a commitment to stay and work in a health provider shortage area upon graduation and certification. So it's a really great bill. We have bipartisan support. We have set a precedent in getting money authorized every year. I mean, we've been very lucky. We got $10 million last year. We got $8 million the year before. We're slated to get more money this year through the appropriations process, but that could all go away if someone decides they don't want to do it. But if it's already permanently authorized, then they are required to because it's in federal statute. I think we had 15 programs that applied and 10 that were awarded funding. And I mean, it's amazing what you can do with $1 million extra. So it's really great, and it has been the #1 priority of the college. We need to grow our workforce. We need a workforce that looks more like the people it serves. So diversification, both racially and ethnically, is very important to us. Expanding the number of midwifery education programs in this country is of big importance to us too. We know what all the research and the data says and supports. People have great, if not better, outcomes when they use midwives, but they need to have access in their community. We are very strategic because we are small. We do try to do everything in a bipartisan manner. I mean, that is key in a Congress that's divided the way ours are. So the fact that we do have several Republican legislators that are willing to sign on and promote our bill is important. Congress can't pass anything that costs. You always have to have a pay for, but Midwives for Moms is not a cost to the system, and we have lots of support on both sides of the aisle, so it's good legislation.